I'm talking about babesia genus, and specifically the microti species. And the way you can remember that is because like babesia, and micro, like micro baby, that's the most diagnosed in the U.S. infection. And it has a lot in common with malaria and Lyme disease. For instance, what it has in common with Lyme disease is the same region, so like the southeast United States, and the white-footed mouse is the animal reservoir, and then the Iodes tick is the vector that bites humans. So the vector is Iodes ticks. The babesia microti gives us babesiosis. In most people, that's not really a big problem. It's pretty asymptomatic or mild. Might have some general malaise or some fever, and fever is without periodicity, so you might have like a summer flu. It's any time of the year. It's not exclusive. Headache, chills, sweating, fatigue, weakness, just some like general mild symptoms in normal people. Somebody who's immunocompromised, such as an HIV patient, or somebody who is asplenic or functionally asplenic, they're the ones who are going to have an increased risk of having worse symptoms. And so those worst symptoms are hemolytic anemia, renal failure, hepatomegaly, and splenomegaly. And those are a lot worse in immunocompromised patients. So it kind of has a long life cycle, just like malaria. So after the trophozoites are in the body by the tick at this time, instead of going to the liver, though, they go straight to the red blood cells. So that's how it differs from malaria. So no liver, just go straight to the red blood cells, and that's where it multiplies. You can diagnose it by looking at a blood smear, and you can tell the difference from malaria in the blood smear because you'll see a tetrad ring in the red blood cell, and that's just four bacteria put together. And you would treat with clindamycin and quinine. So the micro baby, has a tetrad ring, 4 ring in the red blood cell, and you treat with clindamycin and quinine.